remiss of me not to congratulate Eswatini, not to congratulate His Majesty's government and all of Maswati for all the efforts that have been made to meet targets, and even meeting these targets ahead of our 2025 target date. So congratulations. Let us continue to celebrate our gains in this journey. And in celebrating these gains, of course, we must continue to remind ourselves what it is that we did well and that got us to this place. And in my mind, these are lessons about community engagement. These are lessons about fighting stigma that we have been reminded about. Lessons about investments at scale. A lot of resources have gone into this. These are lessons about national and global partnerships. But importantly, also for us, it is a lesson about leadership, including the famous call by His Majesty that fighting AIDS was Yindaba Yeku Songe. As I conclude, let me highlight these 2 or 3 messages. First of all, that the success of this new strategy that we are launching today is going to depend not only on the health interventions, specific health interventions, but also on addressing the social determinants of health that drive the epidemic. Poverty, gender inequality, violence against women and girls, the stigma that we have talked about, all these are barriers that we have to address, even as we address the health interventions to deal with HIV/AIDS. Number 2, we have to remain evidence-based. And I'm glad to hear the direction we are going in terms of how we are going to be ensuring testing and going forward. Let's remain steeped in evidence in order to go forward, but also in terms of targeting, gender empowerment, gender-sensitive programming, anti-stigma campaigns, because we know that's where we need to target in order to move forward. Third and finally, let's not forget things that we have done and discussed in the past. I've been here 2 years, and I can remember the campaigns, initiatives that we have launched in the past. And sometimes I sit and listen and watch, and I wonder whether we launched these campaigns and forgot about them. So in the past, we have launched these several campaigns about keeping our girls in school, because if they are not in school, they are somewhere else, and they are falling prey to others. I know the Honorable Prime Minister perhaps will say something about the reverse thinking about this that we were whispering about, and so on. But campaigns about keeping our girls in school is important. Campaigns about eliminating early pregnancies are important, and we have to continue with them. Campaigns to address the cultural norms that stand in the way of killing off this disease and other enabling areas such as violence. And also campaigns I was involved in. I think it was launched in this very room with P.S. Mabuza when he was still at Nurture. This was a campaign targeting men in terms of reminding them of their responsibility. And I remember at that time I coined the word OMG with an exclamation mark. OMG standing for old men having sex with girls. So we have to continue these campaigns going forward.